Action.
So what we're going to show now is soft tissue release weight bearing. So this is an option for you to do as and when passive or active STR fails to work effectively enough. So it could be down to the size of the individual, the handling techniques on the couch that make this particularly difficult. Some of the restrictions that we have with weight bearing are the fact that obviously now the person's muscles are actually working whilst we're trying to lock. So it may seem a little bit more difficult for us to do initially. However, with a little bit of experimentation and so on, you should be able to work with your clients and try out a few different ways until you actually get it working effectively. So let's start with hamstrings, a nice easy one. And if we start with the distal hamstrings, let's assume that this area is knotted up. It may be medial or lateral. Kendra, can you turn to face that way, please? So what I'm now going to do is obviously decide the associated joints. So in this case it would be the knee, and we're going to need to stretch just that distal part of the muscle. So if I look at the lateral part of the hamstrings here, what I'm going to ask you to do is just, if you bring this foot back a little bit, and we're going to bend both knees so that you sink towards the floor. That's it. Okay? Stand up. Okay, so now I lock and you sink towards the floor. Feel that stretch?
Yeah.
Back up. And again, and back up. And just work with your client until you get a rhythm going between you in exactly the same way as you would do this, either actively or passively on the couch. For proximal hamstrings, you can use the standard position for a hamstring stretch. So this foot would be further out, straight knee, and Kendra would be sinking back towards me. So this time from an upright position, I'm going to lock in and down towards the floor. Keep a straight knee this time. And sink back towards me. That's it. Feel that?
Yeah.
Okay. Again. And again, just talk to your client. Sometimes the first or second lock won't work, or you'll find one doesn't. So just keep getting feedback, keep moving the lock around, and so on. Okay? You can turn to face that way. If we now think about the quadriceps, again, proximal and distal, how would we do it? Similar sort of sinking towards the floor, bending both knees, so one foot in front of the other, please. Yep, okay, so let's do this one, that's fine. We'll have that one, that's it. So again, you're going to bend both knees and just sink your bottom towards the floor. That's it, so that's the movement we're going to do. And again, I'm going to lock in the distal part of the quadriceps, sink towards the floor. Feel that?
Yeah.
And again. And I can either get my thumb tips together, or if that doesn't work, overlap them so I get a stronger lock, like so, and that may be more effective. So passively move away to start with. Okay, so proximal quadriceps, we're really trying to isolate largely rectus femoris, but again it's going to depend where we're going to try and lock out, where that tightness is that we're going to target. So this time we're going to need the hip going into extension. So if you swap limb position, so again same stance, yeah. And now I'm going to lock, and you're going to again drop this knee towards the floor. So, a little bit slower. Is that effective? Not so much.
The bottom is.
Okay. So I've got to keep trying until this is successful.
Yeah, I feel it now.
Yeah. And just accept sometimes it is biomechanically a little bit more difficult to do that. Okay. So we've done hamstrings. We've done quadriceps. If we now think about adductors, we've got hip joint that can work the proximal section, knee joint for the distal, but because of the knee actions available to us, we can't really do the distal part of the adductors effectively. So we would get somebody standing, legs astride for adductor stretch. Yep. So if you're going to stretch these adductors, so you're going to sink sideways in that direction, yeah. So I would get my hands in here and pull down towards the floor. And look at her expression. We know that's being effective, yeah? Okay. And again, one's got to be a bit delicate about where your hands are going, but you're going to communicate this effectively with your client, and it's going to be something that they may demand because of the problem. Okay. So that's thigh region dealt with. If we now look at the calf region, if you can turn away from me, please, and just step a little bit further forward. That's it. Okay. So if we now look at, say, the heads of the gastrux, how would we get those to stretch? The knee coming into extension is going to be the way that we're going to do this. So again, just bend slightly. I will lock towards the floor, straighten your knee. Feel that? Okay, let's try again.
Yeah.
Okay, so I'm pressing a little bit harder. So I'm doing just the lateral head here at the moment, and I would just switch around to target the medial head as well. If we are doing the distal part of the calf muscles, the gastrux and soleus, I'm going to have to lock here and lock towards the knee, and this time we're going to use the ankle joint going into dorsiflexion. So I'm going to lock up, and then you're going to sink your knee towards the floor. Back up. Feel that?
Yeah.
Yeah? Okay. And then finally, if we can think about anterior tibialis, this is a slightly awkward one. If you could turn around to face me, please. Just step back a tiny bit, that's it. So there's the muscle there. Obviously we haven't got a joint action that we can associate with the proximal end, so it's all ankle. And this will therefore dictate how far up you're going to try and get your lock in, where the tight spot is. So in this instance, we're going to try and get you knee sinking towards me first of all. I'm going to lock up and just straighten. Can you feel that?
Yeah.
Back down, straighten again, back down, again. And here you can see I'm moving the lock up the muscle so I can target different proportions of it. But I can't work the proximal end because there's no joint there from where it originates. Okay? Happy with that? Okay.